Hi everyone, welcome to my channel, Accessing Care with Naila. My name is Naila. I'm a public health educator that is here to share tips and knowledge with you on ways to access the care that you need while saving money in the process. So the United States spends $3 trillion a year on healthcare. Let that sink in. $3 trillion. And we still have to come out of pocket when we see a doctor. I can't even fathom what $3 trillion looks like, let alone $1 trillion. How about $1 million? I don't even know what $1 million looks like. When I get $1 million, I will let you know what it feels like and what it looks like. Now we living through this pandemic. We try not to catch coronavirus when we leave the house. Something else we try not to catch is that medical bill. Don't you remember that story of that man who was hospitalized for 62 days for being diagnosed with COVID-19, and he had a medical bill of $1.1 million? No one in their right mind is gonna wanna see a bill for $1.1 million. Who in the world? According to Blue Cross Blue Shield, the price of medical care is the single biggest factor behind U.S. healthcare costs, accounting for 90% of spending. Now let me give you 6 reasons why healthcare is so freaking expensive in this country. One of them is administrative costs are high. So what does that mean? Administrative costs are high. It means we are wasting money. That's what that means. We're wasting money on billing requirements from multiple payers like private insurance companies, when we could have a publicly funded healthcare system like Canada. Remember that slogan, Medicare for all? Well, Medicare's administrative cost is much cheaper than what we spend right now in the private systems. Number 2, pharmaceutical drugs keep rising. On average, we the people pay almost 4 times as much for pharmaceuticals as citizens of other industrialized countries pay, which means we overspend in this area too. So there's a certain person that used to say, we must go after the pharmaceutical companies. I know, I'm being silly. Anyway, I remember when I lived in Bangkok, Thailand, and I went to see a doctor. When you're in a different country, sometimes you have some stomach issues. So I went to the doctor, and after I saw the doctor, they said, go downstairs and go get your prescription. My prescription was included in my doctor's visit. Unlike here, you see a doctor, the doctor writes your prescription, and then you go to CVS or Walgreens to pick it up, which is usually an added cost. Number 3, doctors and nurses' salaries are kind of on the high side. I understand. Hey, if some of you guys are mad at me, I'm just the messenger. But that is one of the reasons why healthcare is so expensive in this country, because you guys get paid too much money. Anyway, so U.S. family doctors on average get paid $218,000. That's just average. And a specialist will get paid $316,000 a year. And that is also just an average. So that means there are doctors who get paid way more money than that. And the sad part is that's a lot of people's budget for a house. And it's also another sad part. It could be someone's student loan debt too. But that is really high compared to other industrialized countries, when the Switzerland and Netherlands, their salaries are so much lower. But don't get me wrong, I would actually love to be making $218,000 a year, $316,000 a year. I would love to be making that. So I don't mind. I get it. I get it. And then on average, a U.S. nurse may get paid $74,000 compared to $58,000 in Switzerland and $60,000 in Netherlands. And that's just average, because I know there are nurses who get paid a whole lot more money than $74,000 a year. If you were to see a nurse practitioner instead of a family doctor, then that could be cost savings. Nurse practitioners know what they're doing. Show them some love too. Number 4, Hospitals are profit centers. So what does that mean? Hospital care accounts for 33% of the nation's healthcare costs. I'll give you an example. A typical angioplasty, which is open up a blocked blood vessel, costs $6,300 in the Netherlands, $7,300 in Switzerland, but it's a whopping $32,000 in the United States. And a heart bypass operation in the US costs $78,000 compared to $32,000 in Switzerland. Pay per service. So what exactly does that mean? It means it's in the economic interest of the hospital, the physician, and the healthcare system when they're being paid fee for service. Has your doctor ever said to you, let's just get an extra scan just to be on the safe side? Well, you are paying for that extra service. It falls into that motto of more is better. I find this to be like a catch-22 though, because when you go to the doctor, you want to make sure that you're in good health. You want to make sure you're in good health, right? But you also don't want that extra medical bill either. You don't want that medical bill, that expensive medical bill at that, just for an extra scan or an extra diagnostic test. Just think about the last time you went to see a doctor and thought, was that really necessary? Especially after seeing that bill. Last, number 6, US prices vary astronomically. They vary. The prices vary astronomically because the amounts paid for the same healthcare service can vary depending on where you live, your private insurance company, or the government programs such as Medicare and Medicaid. When hospital systems and pharmaceutical companies are charging for healthcare, they tend to keep the costs high. Why? Because they're negotiating with multiple private insurance companies. However, when these same companies negotiate with federal government, then there's more pressure to meet the demand in order to sell their service. Let me give you an example. So a recent study from Rand Healthcare found that private insurance pays 2.5 times more. Just listen to that. 2.5 times more than Medicare would have paid for the same medical service at the same facility. So moral of the story is healthcare should be a right and not a privilege, and it shouldn't cost so freaking much. The cost of healthcare affects everyone, healthy or sick. Thank you so much. If you have come to the end of my video, please like, subscribe, and press that bell for notifications so you will be notified when my next videos are posted. Thank you again. My name is Naila. I'm a public health educator that is here to share tips and knowledge with you on ways to access the care that you need while saving money in the process. Thank you again. I'll see you in the next one. Bye.